Now it is the #1 cause of sight loss in Ireland for over 50s, and because it's relatively painless and you mightn't even know you have it, Maura.
Today we are talking about age-related macular degeneration, and to tell us more about this we are joined in studio by eye surgeon and spokesperson for the Irish College of Ophthalmologists, Dr. Catherine Cleary. Catherine, great to have you
Welcome.
in. Of course, as Daithí said there, the symptoms you mightn't even realise that you have them. Can you tell us exactly what it is?
So, age-related macular degeneration is the leading cause of sight loss in people over 50 in Ireland. It affects the macula, which is at the back of the eye and which is responsible for your central vision and for seeing fine detail.
Sorry, I'll just pass you that microphone there.
Sorry.
Yes.
So, age-related macular degeneration affects the macula,
Okay.
which is at the back of the eye and which is responsible for your central vision and for seeing fine detail. There are two forms, there's dry and wet. The dry form is less severe and changes more slowly, and that accounts for 80 to 90% of cases. Then the wet form is more severe, and but obviously it's less common. So the type of symptoms that you can get include blurring and distortion of your central vision.
Okay. Can we just show you some images here? So especially if we'll talk about the blurring first, the image we have, we're going to show an image of obviously regular vision, that's normal vision in the pink there, and then tell us about the green one.
So in the green image you can see that the outline of the images are blurred and not as clear.
That's right. And then in the green one?
In the green one obviously you have clear, crisp vision.
Yes, in the green one then it's kind of more blurred.
In the green
you
one
can
it's
see
more
that.
blurred and the outlines of the images are blurred and especially more in the centre. So in macular degeneration you get problems with the central vision and then the peripheral vision remains clear.
Okay, very strange. We can see another image then as well, and you might explain this one for us.
So that's distortion. So you can see in this image that the straight lines have become wavy and curvy.
At what point would you say if you have this, is this after a year or 2 years or 5 years that things will appear like that?
No, usually if you develop symptoms like that, you need to see an eye specialist as soon as you can, because those are symptoms of developing wet AMD, which requires treatment. So you need to get your eyes checked and then be referred to somebody who specialises in treating macular degeneration.
At the beginning though, would you start just noticing, because this is obviously a progressive condition, would you start noticing first a little bit of blurry, but there are black spots that may appear?
You can also get black patches in the vision with this, such as in the image here.
I'd imagine that would be very worrying for someone.
It'd be very worrying, yes, yeah. And it can come on fairly rapidly in over a few weeks. But a lot of people have mild, dry macular degeneration and they just have a mild reduction in their vision. So there's over 100,000 people living in Ireland with macular degeneration, and obviously there's a spectrum. Most people are on the milder end, but then obviously if you have more severe problems, you need treatment.
But the
treatments work very well, and a lot of people are living well with good vision.
But the mild symptoms, I'd imagine people say, look, maybe I'm getting old, and they mightn't take any notice of it, and they mightn't do anything about it.
Well, that's why I think it's very important that people should get their eyes checked at least every 2 years when you're over the age of 50, as part of a general health checkup, because to have your eyes looked at by a specialist and to see if there's anything there that you need to take action on.
Yeah. You spoke there about wet and dry. Which is the most severe one, and how can it lead? Can it lead to not just impaired vision? Can you lose your vision?
The wet one is the more aggressive type, and you can lose your central vision, but fortunately we have treatments now that work very well, and there are a lot of people out there who are able to continue to go about their daily lives and who are on treatment for wet macular degeneration.
What type of treatments?
The mainstay of treatment now is injections, but it depends on the person. Laser can also be used. So the treatment varies according to the individual person.
Yeah, I'd imagine like everything else, if you catch it on time, you have a better chance.
Yes, it's better if you catch it early. And if you catch it early, you do much better in holding on to good vision.
But as we said in the beginning, they're one of the problems that you mightn't realise you have it because it's relatively painless.
Well, that's why it's important to get your eyes checked fairly regularly so that you know, try to pick things up.
We have this is what you call here the Amsler grid, and it's almost like a test. Can you tell us a little bit about that?
So the Amsler grid is designed for so people can monitor their eyes themselves at home for signs of macular degeneration. So what you do is you put on your reading glasses.
Okay.
And you look.
I'll do this now. I'll be your tester. So you put on your reading glasses.
You put on your reading glasses, yeah. And you hold it up at about comfortable reading distance. And you need to do one eye at a time. So you cover your left eye and check with the right eye.
Is that a comfortable distance there, is it?
That is probably, isn't it?
Well, if it's in focus for you.
Yeah?
Yeah,
Okay.
yeah. So about, you know, I suppose reading distance is usually about arm's length.
Yeah, arm's length, yeah. Which is that, exactly.
So you look at the line, you look at the white dot and you make sure that the lines around it are straight and that they're not bent or curvy.
The white dot, or the black dot in this case, yeah?
Yeah.
So if you see it like this, as we're seeing on screen here, that's okay?
That all looks perfect.
Everything's okay, but if it's not okay, it's got to look like this?
Yes.
Okay.
Yes, or you may have blank patches in it as well, or black spots in it.
Are people predisposed, are certain people predisposed to this condition other than others?
Well, it's an age-related condition, so the number one cause is getting older. If you have a positive family history, you are at higher risk. Smoking also increases your risk, and a poor diet is also a risk factor. So it's good in your diet to get plenty of green leafy vegetables and brightly coloured vegetables and oily fish, you know, your omega oils, so like salmon and mackerel.
Okay, so you're probably looking at vitamin A being very important in this, are you? Or is it oils rather than that?
There are a range of vitamins that have been studied, and there's a combination of them which is particularly beneficial. And there are special eye vitamins that you can get.
That can help
But it's probably good to take medical advice before you take those.
Okay.
Catherine, remind us, where can we get this? Anyone watching at home, where can they get this?
There's a new website which has been developed, www.amd.ie, and there's an AMD symptom checker on that, so you can learn more about the symptoms of AMD. And you can also download the Amsler grid from there.
Could you make a mistake in the sense of you have certain symptoms? Could you maybe think you might have cataracts or another eye condition?
Yes, well, that's a very easy mistake to make. People think that their vision is slowly getting a little bit worse and they think they may have cataract. Cataract gives a slightly different symptoms in that it causes a more generalised reduction in the vision, whereas macular degeneration affects the central vision. But you can have the two things together because they're both age-related, so that's why getting your eyes checked is so important.
Yeah, twice a year, you reckon?
Every 2 years.
Every 2 years.
Every 2 years,
okay.
yeah.
Okay, and obviously if you have any symptoms, go to your doctor first. And
yes,
then
if you have any symptoms, see about it quickly.
Brilliant.
Yeah.
Thank you so much for coming in. As Catherine was saying there, more information on age-related macular degeneration, you can pop onto amd.ie and you can download this, what is called the Amsler
grid there. It's
from
all
there. You can check that at home. Obviously then do take medical advice after that. Thank you so much.